We are here at the 20th International Congress of Parkinson's and of the Movement Disorder Society. We are in Berlin, and today is the 21st of June, 2016. My name is Mariella Graziano. I'm a physiotherapist with a special interest in movement disorders, and I've been engaged in the running and the organization of the Special Interest Group for Health Professionals, Non-Physicians, since its creation in 2009 in the Movement Disorder Society. In addition, I am the chair of the Association of Physiotherapists in Parkinson's Disease Europe. But more important of all that, today I have the pleasure of interviewing Ruth Hagestuen, who is a very much loved and very admired nurse in the field of Parkinson's. But we will know much more about Ruth through along this conversation. Now, Ruth, please, could you tell us about your early years and your education, please?
Thank you. And thank you for inviting me to be part of this. I'm very happy to have this opportunity to talk with you today. Well, I'm a nurse, and that is a core, really, of my education and my lifelong learning. As a nurse, I have worked early in my life in other countries. I lived in Madagascar for about 9 years and worked with midwives to set up a program for mothers and children under 5. In that process, and before that process, I was studying cultural anthropology. And the experience I had there, learning the language, learning the culture, creating a program, and executing that program has really been as important in some ways as my nursing in what I've done going forward, because it's contributed so much to my ability to plan programs, to deal creatively in different environments. So that was my first international experience, and then I lived in Bangladesh for a few years and worked on developing some medical care there. And that then built upon this. When I came back to the United States, I studied theology with an emphasis on pastoral care and counseling because I was so interested in reflecting on my prior experiences, really looking at the whole person and how I could integrate all of that in my life. So that was sort of my introduction before I got into Parkinson's disease, which was really more than midlife.
Yes.
Instead of, right after my my nurse's training, when I had my nursing education, I had a few years of nursing before that as well.
That's very revealing, Ruth. Thank you. So now you already told us how you integrated in a way to Parkinson's, to the world of Parkinson's. When exactly that happened in your life?
Well, it was 30 years ago, actually. And I was looking for a way to find an opportunity to work with people in chronic care and to deal with all the aspects of how it affected their lives. And really knowing that the healthcare system in the US was more oriented to acute care than chronic care. So the possibility of having people with a chronic illness get cared for over time as they're needed was my goal. And there was this opportunity that presented itself at a wonderful place in Minneapolis, where they already had an interdisciplinary team caring for people with Parkinson's. So I was hired as the nurse for that clinic. I was the nurse coordinator. I saw all the patients. I took all the phone calls and worked then in helping manage that interdisciplinary team. And we developed many new programs of outreach as we worked with people that were living in that 5-state area. And people came actually from across the country to that program. It was just a perfect first 10 or more years, I forget if it's 10 or 15, that I had in that program, where we continually developed new programs and eventually moved to a freestanding facility that is just simply for Parkinson's, that has support interdisciplinary care, movement disorders people, physicians work there, as well as PT/OT, speech, social work, music therapists, and other volunteers. So there are multiple programs within that.
What a progress. Now, could you tell us who were the people who influenced you most in your Parkinson's journey?
Well, really, I think the leaders of that program initially, because it was created out of a vision by a movement disorder specialist, actually a Parkinson's specialist, who was a neurologist but really committed his career to caring for people with Parkinson's. We didn't really have movement disorder specialists when he developed that program. He didn't develop it. He had the idea for it. And then he approached the leaders in this rehabilitation unit in our community hospital, who all bought into the idea. So when I came on board, they were having their clinics already, and it operated out of this rehab center in the community hospital. And I was really influenced by the people on that team who were so dedicated and so knowledgeable, each of them, in their own practice. And really, beyond that, I've been very much influenced by leaders in the community whose lives are affected by Parkinson's and joined in the effort and really helped educate me. And of course, the patients and families on a daily basis that you see are really the, kind of the heroes too.
Absolutely, absolutely. Now, what would have been the great scientific challenges, the greatest scientific challenge or challenges you encounter in your journey?
Well, working with that team, it was a very complex program where you have a whole team assessing people with Parkinson's and their family concerns when they come in for clinical treatment. So they're seeing multiple professions at one time in one day, and they're treated over time in an environment that offers so many opportunities. What I would like is to have been able to measure those outcomes, because we knew how wonderfully everybody responded to that and how beneficial that was in comparison to people who we were seeing being treated in other places without care providers who really knew Parkinson's or had an integrated care team. So I think finding the ways that we could really show scientifically the benefit of these programs, but the complexity makes it very difficult.
I think that observation is a contribution. Now, you have experience, you know many things about the field. Where do you think the field is heading at the moment?
Well, I think it is really heading more from the focus on acute care to how do we better care for people with chronic illness. I think there's a lot of attention to that in the system as a whole, the healthcare system as a whole, and in the Parkinson's and movement disorder realm as well. And we need to find ways then to have teams working together and also to manage how we teach others and get the right information to the people with Parkinson's. I think there's a direction of more self-management. People with Parkinson's are now much more active and really involved in their own self-care, and of course that's the direction we've been going for some time, but I think looking at ways to do that better, for us to be able to work with people more effectively, to really have what we've been striving for in terms of patient and family-centered care, where they're really involved in making their own decisions about care and where they feel self-sufficient and confident as they go forward. And then I think too, we're being more sophisticated in terms of how we work with people as they're diagnosed. Some people find it much more difficult to accept the diagnosis, and if we as a team are able to just meet each person where they're at and work with them with them in terms of accepting or getting the information when they're ready for it, and integrating that into where they are. That's more helpful than just dumping a lot of information on people as they're diagnosed. Others, of course, are relieved to get the diagnosis and say, what should I do next and what do you have for me? And so I think learning more about how better to do the treatment and then finding ways to provide the right information at the right time over time, and that goes for information, support, and especially care. And then, looking at even late stage, I was talking about self-sufficiency and self-care, but there are times when it becomes so complex that the self-care is difficult. So therein, we look at how we've been working with the caregivers over time and how best can we support the caregivers and work with both caregivers, family, and also the patient as they move into very complex stages that may require palliative care and hospice. But I think we're really getting better at that, and I think there's greater sensitivity in terms of Parkinson care providers about how to do that. But we're doing more research, we're understanding it better and building the capacity.
Now, what advice would you give to young health professionals who would like to be involved, specialized in the field of Parkinson's and movement disorders?
Well, I think it's very important, first of all, to have a strong academic background. They may start with general education as they find their way and decide to move into movement disorders, but then to become as academically qualified as possible is very important. And then to combine it with practice, clinical practice. Even if someone is going into research, I think it's very helpful because we learn a lot in real life once we've gone to school. I mean, people from many professions tell me what I really needed to know I found out when I got out there. You get your credentials, you get a lot of knowledge when you're in the educational process, but in the real world is when you need to apply it and then become kind of a lifelong learner. Yes. Which is we all need to do. It's one reason we're here at the Movement Disorder Society.
Yes. Now, if you could turn the clock backwards 20 years, what would you have done differently?
Well, as a nurse, I have always seen and known how important the role of a nurse is. And I feel that we have developed the system of care in a way that has undervalued that contribution of a nurse. And one of the reasons that I think that's happened is because it hasn't been really studied scientifically. So you have now physiotherapy is doing all kinds of wonderful research to show the outcomes of their specific discipline. And the same is happening in OT, occupational therapy, or speech language pathology, and of course neurology and other specialties. But the nurse is sort of coordinating all of that and following the patients over time. And I think it would be helpful to have more outcomes related to the impact of nursing care over time. I feel that the nurse has a great contribution to be made just in the outpatient clinic or inpatient in the hospital setting, that often they don't have good information there, and the ones that do really make a huge difference. I also feel like nurses can be case managers over time that help people across different settings. If people need to be even starting new medications to help follow up with that, to keep people in communication with you in case they need greater clarification about the intention of the medications, how to take them, to check in with them down the road, or if a crisis comes up, to be able to contact that case manager and say, this is the situation, if they need to be hospitalized, to be followed in that way. I really think it would make a difference in the care and in the lives of people with Parkinson's and their family members.
Yes. Now, How do you manage to maintain a balance between your working life and your personal life and your own self?
Well, now I'm not working quite as much as I used to, but I really all along I have valued exercise. I mean, I have seen in my own life that what we are really preaching to people with Parkinson's and their care partners is that when you exercise, you feel better. And so I do a lot of walking and biking, so that, and other kinds of exercise too, as I'm able. There are a number of things I'm involved in. I also love reading and theater and movies, and so those are always helpful for me.
And you're also very good for a laugh. You like laughing.
I do. I love laughing. I love humor. Yes. Yes.
Now, you've been involved in the Movement Disorder Society for a long time. Mm-hmm. What type of role do you think this society has played and plays in the field?
Well, I think the Movement Disorder Society is really offering an important opportunity for not only movement disorder neurologists, but movement disorder specialists in all the disciplines, because this is a global world now where so many connections are made, and where we can learn across cultures about how each of us is responding to the needs, and we create different ways of responding to those needs. There's a lot of sharing of research here. There's a lot of sharing of all kinds of initiatives that are going on. I know when I worked with the National Parkinson Foundation and started understanding what the interdisciplinary teams are doing in other countries, it was an eye-opener for me, and it really helped us in our planning and advancing what we were doing. So I think this opportunity to share ideas and share learnings across cultures and across countries is really something that we are having the opportunity to do here, and we ought to maximize. So.
Yes, and we had the privilege to have you as chair of the Special Interest Group of Health Professionals, Non-Physicians. What would you tell us about what it meant to you? What do you think the group is, and what that could give us in the future?
Well, really, I mean, a number of us have for many years attended these meetings to learn what the latest research is, et cetera. And we have started together to learn from each other here. And now that the Special Interest Group for Health Professionals is really a real designated group, and the Movement Disorder Society has made it a goal to integrate the health professionals more, I think that we not only have an opportunity, but we have a responsibility to come forward to work with the society to integrate health professionals more fully in the program. There is so much wonderful research going on, and what even the physicians say to me is, I really didn't understand, what the other disciplines do, and I am so appreciative to know how they complement what we are doing and how important each of these disciplines is. So I think that this is something that we really need to work together on, as a whole society, that it's a special interest group now. We meet, we have some things integrated to the full, we have some things that are separate with this SIG, but what we really want to do is be fully integrated into the whole, including the Congress programs, et cetera.
Thank you so much. I think with your example and many other examples of our colleagues, I have no doubt the field will keep on going forward.
Oh.
Thank you, Ruth.
Thank you.